It's Victoria Field, co-host of Metabolic Health Summit, and two of my organizers, Dr. Dominic D'Agostino and Dr. Angela Poff, are going to be joining me live today. And we've got a very special live because we're going to be giving away 2 tickets to MHS 2020, which will be in January in Los Angeles. It's going to be a ton of fun. The way you enter is liking this live, so engaging with us, sharing, as well as commenting. So like, engage, share, and comment. That's how you get entered. And it can even be in the replay. So if you're watching the replay, you can go ahead and do the same. And we're going to be picking a winner for 2 tickets to Metabolic Health Summit, an incredible 4-day conference, bringing you the very latest science on nutritional ketosis, metabolic therapies, and its application in everything from cancer to human optimization to Alzheimer's, you name it, right in one place in LA. Hi guys, thank you for engaging. So definitely keep up with us on this live because we are going to be giving away tickets, and that is going to be announced on Monday, the 23rd. I'm going to go ahead and invite my co-hosts in here. First, before we kick things off, we should probably explain to those who don't know what Metabolic Health Summit is, what it is, how it started, and if you guys want to share your thoughts on that from a scientific perspective and how we kind of bring it all together. I like to call it an experiential scientific conference, but I'd love for you guys to share your thoughts on what it is exactly for those who don't know.
Oh, okay, sure. So I like to think of Metabolic Health Summit as a platform for collaboration. It's a place that we literally bring the world leaders and experts in ketosis and metabolic therapies to one place, everywhere from the clinical application side to the basic science research scientists to students to entrepreneurs and industry leaders and just people who are very excited about advocating for their own metabolic health. And we talk about the latest science in these fields. So we're very dedicated to providing a very evidence-based platform. So we make sure that what's being presented there is the latest of the best scientific evidence that's out there. And we just provide this platform for people to network. So it's really cool for us, I think, as scientists to be able to be in the same room as clinicians or scientists in the fields or someone that is dealing with something personally, and we can really all learn from each other. So I kind of think of MHS as a place to foster those kind of collaborations.
Yeah, really the science absolutely. And the application of the ketogenic diet, of course, but also other metabolic-based therapies. To have that platform where basic science researchers can talk to clinicians and also have it not exclusive like other conferences may be, where you have people from the outside. So educated lay people are obviously invited, companies, people who just want to network, influencers. It's a good synergy of all these different things, and I think that's what makes MHS unique, is that it provides a broader platform. And it's really sharing that information and collaborating and networking that's going to move the field forward when it comes to sort of, and also implementing this approach. So I will be taking some other conferences where we'll be talking about the science, but it's not actually clear. We kind of end up, well, how do we implement this approach? For American Epilepsy Society, for example, where they are mostly drug-based, but there's a special interest group specifically for the ketogenic diet. And the big theme this year is how do we implement it, and especially in adults.
Yeah,
so we'll
absolutely.
cover all that at MHS. I probably talked too much, but
No, that's great. It's a little bit of something for everybody, really. I mean, whether you're in need of continuing medical education credit, which we do offer through our partners at Cedars-Sinai, to you just started the diet and you really want to dive in head first to some of the science, but also what it means in the real world. I mean, that's the whole point, right? And we called it Metabolic Health Summit because it's the ketogenic diet. We talk a lot about that, but it's inclusive of a variety of topics that bring you the very latest science on how to improve your metabolic health. How do we maybe look at disease and look at some of the choices that we're making, that the power that we have day to day and what is the science? Really, what is the latest science? So we're hearing from a lot of great people in the room, and we do have some questions to answer that we're going to kind of dive into today. So if you have questions, definitely ask them, and we'll try to get to them today. We do have a couple already that we're going to hit. A few people are making some great comments here. One person, Charles, said he's been doing keto since the 60s. Which is pretty awesome.
Wow.
Hard charger, yeah, leading the charge here. I love it. We've got some requests on speakers. If you haven't seen our latest speaker list, you can actually head on over to our website. We've been adding people to that list. A couple of people are asking about Dr. Jason Fung, who we do love. So you'll have to stay up to date on that list on our website and in our newsletter to see the latest speakers that we've got. But I want to ask you two, because we did get this question on one of our posts today about the ketogenic diet and some of the science around chronic fatigue. This is something that obviously is brought up a lot because a lot of people, I think, suffer from this sort of thing. And the ketogenic diet might have a place, in that specifically. So if you want to comment on that and maybe some of the science going on with chronic fatigue.
Yeah, so I saw that comment or that question come in. I thought it was really interesting because I think it is related to, at least anecdotally, a lot of people kind of report feeling a lot more energetic when they make some of these dietary changes like going low carb or potentially keto. And so I looked at the literature on this topic. It was interesting. There really wasn't a lot of primary research, so studies actually testing this hypothesis. But there was a medical hypothesis paper that was published fairly recently, which is basically when someone wants to kind of put together the theoretical reasons why we might want to study something, right? So if something theoretically makes a lot of sense, and it's kind of like a synthesis of the ideas behind this. And so the paper actually said that it was suggesting we study what are called mitoprotective diets, or they were calling mitoprotective diets. It's a term I'd never heard of before, but I like that idea, the idea of protecting the mitochondria. And they were talking about intermittent fasting, calorie restriction, and the ketogenic diet. And so they were mentioning, and this was in the context of chronic fatigue syndrome. And so they mentioned that in chronic fatigue syndrome, you have this chronic inflammation that incites damage to the mitochondria. It's coupled with excessive oxidative stress that exacerbates that damage. If you think about it, these free radicals that are being made, a lot of it's being made in the mitochondria itself. So just because of this close proximity, the mitochondria are very susceptible to this oxidative stress-induced damage. And so you have that over time, you start to see mitochondrial dysfunction that contributes to fatigue. And it suggests that diets that are potentially capable of protecting our mitochondria or repairing some of the damage that's been done to them could be potentially beneficial. And since we know that ketosis can be induced by all of these diets that they were mentioning, intermittent fasting, calorie restriction, of course, the ketogenic diet, that ketosis, the state of ketosis we know is associated with reduced oxidative stress, is thought to also support mitochondrial health. They suggested that, hey, we need to study this. It makes a lot of theoretical sense as to why these mitoprotective diets may be beneficial in something like chronic fatigue syndrome. So I thought it was really interesting. Of course, it was just a hypothesis paper, so there was no actual data on it, but maybe someone will do those studies pretty soon because I think there is a lot of anecdotal reports to suggest this might be going on.
And I think there are people studying it or interested in studying it. And as a reviewer, I see things coming through on different study sections where they actually plan to do brain imaging and also do like a cytokine profile to look at various inflammatory cytokines that may be causing systemic inflammation, also neuroinflammation that may be linked to chronic fatigue. So I know there are proposals out there, they're being reviewed, and people actually do have an interest. So you'll start to see, I think, some data and hopefully publications coming out on this topic.
Yeah, it's really interesting how much sort of the vast variety of topics that are being looked at with nutritional ketosis and, its potential role in a variety of things. I always feel like, sometimes you sound so kooky when you're like, yes, it applies to this, and this, potentially. And people are like, well, what is it? It's food. And that's a pretty exciting thing because that's something that we can change day to day ourselves, right? So We have got a few questions and people here. One person asked, are we giving free tickets to the conference? We are. And you will need to go ahead and comment, share, and like this post, and you'll be entered to win. And we're going to be picking a winner at random on the 23rd, which is a Monday. So the more you engage here, the more likely you might be to win a ticket to the conference. So I have another question for you guys. Something that we actually brought up this week that somebody had commented on as well is GKI, the glucose ketone index. It's a term coined by Dr. Thomas Seyfried, who's one of our speakers, who's also incredible researcher when it comes to metabolic therapies and cancer. And if you guys want to explain why that sort of came about and how he put that together and sort of its importance in the research, moving forward. In your opinion?
Well, I think there in the review article that was written by Tom Seyfried's lab with his student and collaborator really summarized the information showing that it was the GK index, or glucose ketone index, and that's glucose over ketones in millimolar concentration, that a therapeutic sort of space to be is within that 1 to 3 or 4 range. And I know that Dr. Seyfried really likes to see it closer to the 1, but that's not necessarily feasible with the ketogenic diet alone. I think there's other strategies to implement for that. But when it comes to managing cancer, growth, and proliferation, that GK index, most of the data written has actually focused on that. In the epilepsy world, they also acknowledge now, and they came in a little bit later, that glucose and insulin are extremely important. And there's a drug called 2-deoxyglucose, and that glycolysis blocker is actually, they call it the ketogenic diet in a pill, right? And that's there's clinical trials right now going on, and it has tremendous anti-seizure effect. So when we follow the ketogenic diet, we typically see an elevation of ketones and sometimes a decrease in glucose, especially if calories are restricted too, and less glucose fluctuations. So we think it's the balance. The glucose ketone index is a better single biomarker that summarizes the shift from a normal physiology to a physiology that's adapted to burn fat and ketones. And that the therapeutic index probably lies within the 1 to 4 range, in my opinion. And some people differ on the ranges, but a typical glucose ketone index is like 10 to 20. So if you are even getting down into the 5 range, you are outside of the spectrum of normal physiology. So I think people should appreciate that when they're trying to use that index to get into a therapeutic zone.
Yeah, and it was interesting, in his paper, how he did this. I think in medicine, people are always looking for a more simple biomarker to reflect prognosis for any condition or outcome of a new therapy. And so he had gone back to the literature and looked at all of these studies that had instituted something that's going to affect glucose and ketone levels in cancer. A lot of this was primarily coming from animal models. And he took the data sets and basically ran an analysis that showed, he calculated the GKI for all of these data points, and then showed that just GKI was a powerful predictor for outcome. So that these lower GKIs that you got in the studies that were evaluating ketosis were associated with a better outcome in those animal models. So it was an interesting, proof of concept that he went back and kind of applied this new idea to data that had already been published and was able to validate in that sense that this may be, it seems to work well in terms of our animal models. So it's something that might be useful in the clinic as well, especially as we're moving forward and more clinical trials are being established. I think a lot of investigators are actually putting the GKI as an endpoint that it's being followed in the clinical trial. So it could be a very useful biomarker for clinicians as these therapies become more common.
Yeah,
and they're usually inversely proportional. So as glucose goes down, or conversely as ketones go up, you see this inverse proportionality. So interestingly, that even occurs with exogenous ketones. When you administer exogenous ketones in different forms and elevate your blood ketone levels, there's counter-regulatory things going on that we don't fully understand, but it tends to lower blood glucose. So today, I tested a new product on the market, and it dropped my glucose from 83 to 63 within 30 to 60 minutes. And that's not, changing diet. That's just elevated my ketones by 1.5. So I'm not going to say what the product is, but it's out there. It's commercially available. And it was the first time, I tried it. But it's a good demonstration, to show that elevating ketones for reasons we don't completely understand. And I've measured insulin levels too. So if you elevate ketones high enough, it can release insulin. I get this question all the time. But if you don't elevate it above 1.5 or 2, the insulin level is non-detectable with the kit I use, at least. So, or it's very, very small. Wow. It's not very significant. It's not like eating the insulin elevation you get from eating glucose or protein. So I get this question over and over. Do ketones, elevate insulin and will they shut off fat burning? Well, that does not appear to be the case, at least with the commercially available forms on the market. Maybe the ketone esters, in high concentrations, they do that, but the ketone salt and MCT products don't do that.
Yeah. Okay. No, that's a great point that you bring up, and I'm sure you get that question all the time. And one thing I want to mention, you were saying how it just nutritional ketosis alone, the diet alone, might not be necessarily enough to get to that sort of goal number for GKI. And it's something that I had experience with through Epigenics Foundation, where we had some pilot studies going on with cancer patients. It can be quite a challenging thing because you think about some of the treatments, at least with people, some of the treatments that they're going through and the stress that's causing on the body and sort of the effect that has on hormones and everything else. It can be challenging to get those numbers to where you want. So that's where maybe some other tools might come to show down the line, that if we throw the kitchen sink at this thing and incorporate a variety of therapies, maybe this is the way to go. So it's a really interesting topic. Somebody actually had asked Kim, who we certainly like over at Metabolic Health Summit, Kim Howerton. She said, I see a lot of folks trying to extrapolate GKI to optimal fat loss. Is there any basis in this, or is it simply over extrapolation? I like your use of words there. So what are your thoughts on this?
That's a good, I never really thought about it from that context. I think about it from the epilepsy world or the cancer management world. But the lower your GKI, the greater insulin suppression you have, and the more ketones you're making, and they're fat-derived ketones, maybe even in the context of supplemental ketones. But I think GKI is a pretty good indicator of your overall fat and ketone burning capacity. So I think, the longer you keep a lower GKI, the more you're kind of training your metabolism to burn fat.
Yeah, it definitely makes sense. It's, to me, it's a really nice value to just show kind of the depth of ketosis that an individual is in. We know that with significant fat loss, you do typically get a more, significant level of ketosis. So I definitely would not be surprised if a lower GKI was associated with more significant fat loss. But it just makes sense theoretically to me. I don't know of any research that's actually looked at that, but it makes sense in my mind.
So if you had a low GKI, but you're also getting in surplus calories, I think it would make it difficult to burn fat and lose weight. So I think I'd like to throw that out there. I think calories do matter, and the extent to which they matter is a bit debated. But I do think that if you have, it's unlikely that you'll have a low GKI if you have surplus calories. So that's the thing. But I've seen it in kids. They're eating enough to gain weight, and they have a really impressive GKI for seizures. So
incredibly metabolically flexible, and there's so many things that are going on, and people differ so much, person to person. And even things like lean mass might play a role in ketone levels. And there's so many different factors here. Somebody asked about GKI for dogs, a veterinarian from Mexico. I actually worked with dogs at Keto Pet Sanctuary, which is a nonprofit that's done work with dogs with cancer. And I don't know what you guys would have to say about this, but it's hard to get dogs' ketone levels up high. They seem to use ketones more maybe efficiently, so they don't have as much circulating in the blood. But I think you probably could use a version of it, but you might have to come up with, there might need to be something specific to canine. What's that?
Yeah, I would say probably there's going to be a totally different scale, just the reality of what is feasible in that species. And I mean, it's also related to kind of what you were already mentioning, you know, the amount of lean mass that someone has, right? Sometimes people, you know, feel like they need like pretty high ketone numbers. That doesn't necessarily mean that that's a great thing, because if your ketones are like really high, you might not be burning them very efficiently. So a lot of people, especially athletes, they don't really get these massively high ketone numbers, but it's because their body's really effective at pulling them out of the blood. If they're not in the blood, you're not going to see them on the meter when you're testing, but it doesn't mean you're not making them. It just might mean that you're burning them.
So for dogs, the ketone level may be hard to get up, but glucose drops pretty fast. You put them on a ketogenic
and very low.
Like very low. So that's an interesting thing, that they may not necessarily go into clinical levels of ketosis, but they can sustain hypoglycemia with a relatively, you know, modest carbohydrate or calorie restriction too. So I know you've seen that, Victoria.
It's really interesting. I mean, they'll get down into the 40s, low 40s, and, you know, the happy as can be, like dogs are. You would know any difference because, you know, they're also producing ketones, but typically that's between like 0.3, 0.5 for a dog, whereas for us, technically it's 0.5 and above. Okay, I've got one last question here that would be a great one for, I think, the two of you. But before we go and ask this, I want to mention, share this post, this live video, or even the replay. If you're watching this after the fact, share it, comment, like, and we will be picking a winner for 2 tickets to Metabolic Health Summit, a scientific conference that you don't want to miss. That's for everybody from the clinician to the everyday person just wanting to get a solid understanding about the science behind metabolic therapies and the ketogenic diet. So somebody asked here, what are you most excited about when it comes to the research behind exogenous ketones? Like, what is you guys cannot wait to see where it's headed. What is that for you two?
Well, we have a review. It's accepted, right? It's accepted. So I guess we can say it now. I mean, it's not okay. So we have a very
you heard it here first.
We have a very comprehensive review on exogenous ketones with a focus on ketone esters and seizures and overall neurological, but with a focus really on seizures. That really we think will be, you know, I guess probably the most comprehensive, you know, article written to date, and it got accepted, I think, like over the weekend. And you know, I think the thing that I am most excited about, especially working with the epilepsy world, is this idea that we have a tool in the toolbox, which would be exogenous ketones, to increase the therapeutic efficacy of the ketogenic diet or augment it. I think of ketones, exogenous ketones, as another form of energy, another form of food. So that can be used, incorporated, and added to the diet as a source of calories to manipulate the GKI, the glucose ketone index, into that therapeutic range and sustain it there. And it's particularly very important for patients that just have a hard time with the diet. Some cannot tolerate high fat levels and things like that. So, but I think,
that's exciting.
Of the things that I'm most excited about, I think in terms of the anti-seizure effects and the neuroprotective effects too. So we work with the Office of Navy Research. That's one of our big projects that we have. So for warfighter protection in extreme environments, we think that this technology has a lot of capabilities.
Yeah, I agree. I just think it's a very exciting area of research that is going to provide, I think it'll provide an option for people who maybe would not be able to use ketosis. So I'm excited to see the research continue on that. And as Dom mentioned, I think that the neuroprotective and brain health enhancing effects of ketosis is something that potentially exogenous ketones could really play a big role in, especially as we age, thinking about how the aging brain becomes less able to metabolize glucose, but really seems to hold on to its capability to metabolize ketones, and thinking about just making sure that we continually supply energy to our brains as we age in those settings. So I think that that's a really, really cool area of research, and we're going to see that this could be a really effective tool.
And we're learning from the patients out there who are already doing this. So I know a lot of people listening may not have epilepsy or seizures, but the feedback that we get from people, that I get from people, telling us about how this product or formulations can help them, that gives us insight into actually what's working and what's not. And that actually even influences the direction of our research, what things we decide to test. So from a general everyday brain health, brain energy perspective. So we are learning a lot from the patients. And I know you, Victoria, you work with a lot of patients and you have learned a lot of lessons from them, life lessons and health lessons and keto lessons.
Yeah, absolutely. And then somebody who, it's so great to hear your perspective. You guys are in the trenches. You're doing the important work that needs to happen on the science front. And just from an outsider, but somebody who's worked with patients, like I would 100% agree with you that when it comes to brain health, I feel like it's probably the most exciting application is there. Just in what I've personally seen with somebody starting a ketogenic diet and just feeling that, that new sense of focus and empowerment for a patient that, is still focused on brain health because it's focused on mental health, right? That shift, allowing somebody to feel like they can do something, maybe even if it's in the format of exogenous ketones with epilepsy, maybe they weren't able to do something before and now they feel like they have a tool. Brain health, I think, is such an exciting time for that because, and much like what you talked about, Angela, with, as we age, going back to more of, focusing on ketones as that fuel source for the brain, much like when we were born, it's kind of like this circle of life, right? We got to bring it back to where we sort of started. And it's an exciting time. So we're going to be covering all of the latest science when it comes to brain health at the conference, as well as a variety of other applications to, Dom's talked about some of the work that you guys have done in environmental extremes, which is fascinating, to, autism, to cancer, you name it. We've got a variety of incredible speakers, some of the top in the world, that will be coming out to Metabolic Health Summit. And actually, Mike Dancer is on the broadcast. He is incredible. He's an incredible example and inspiration of somebody who's been able to use the diet when it comes to adult epilepsy, and is such a solid advocate for that. So thanks for watching, Mike. Got to just give you a little shout out there. But for those who want to learn more about the ketogenic diet from now until the conference, we post a ton of content online on our Instagram, Facebook, YouTube. You can find great pieces of information. Actually, we made a post about GKI using Keto Mojo, their graphic that they put together, who will also be out at the conference. So make sure you stay tuned to our social accounts. And thank you guys for taking all the time. I know you guys are so busy in the lab. If you have not yet done it, share this post, comment, ask questions, because we're going to be doing more of these as we get closer to the conference. And you can check it out, all of the information about MHS 2020 at metabolichealthsummit.com. Anything else that you guys want to say before we head out?
No, I don't think so.
You're like, we're ready to get back to work.
Yeah.
Yeah. Well, thanks, guys. We will be going back to planning, and we will see all of you very soon. Thanks for tuning in. We'll see you soon. Bye, guys.
Thank you.
Bye.
Bye, everybody.